Good day, everyone, especially to our Professor Sir Landon Kenneth. I am Glenn Malayo CABUCHETE, teaching grade 1 in Selway 8 Elementary School. Today, I will present to you my report in Idman 201, Program Development, Management, and Education. My topic is all about program implementation. The purpose of this unit explains the procedures for carrying out program tasks. Planning must include the development of procedures that ensure the success of your activities when the unexpected take place. Key factors to be considered in program implementation include the role of the media, recruiting volunteers, implementing sound management practices, supervising staff and volunteers, establishing accountability mechanism, and developing collaboration. Learning objectives explain the importance of program implementation and outline an implementation plan for a program. Identify the elements of program design that ensure successful implementation of program activities and explain why they are important. What does program implementation mean? According to Joseph DURLAK, implementation of the program refers to the degree to which the proposed intervention program is put into operation, and it is important for determining the internal, external, build, and statistic validity of the outcome assessment. Why implementation is important? Implementation is the way of organizing a strategy or policy so that the idea become a reality. Managers should convey clear objectives and goals and provide workers with the tools required to help the organization accomplish its objectives in order to execute the plan properly. Program implementation. To execute the software, you must establish procedures for carrying out of tasks. By now, you should have defined the goals, objectives, and tasks that your company will be implementing. You should also have established and obtained the required resources, and your leadership system should be in place. Although it is difficult to guarantee that nothing goes wrong, you should have a fair amount of confidence and it is going to work well. However, you should be prepared for unforeseen defects, and the frequency of comebacks. Therefore, preparation must also involve the implementation of procedures that ensure the effectiveness of the plans in the event of an unforeseen event. If you have gained community and financial support, assign tasks to ensure the successful delivery of the program and create a sustainable system for its continued operation. The following elements will help ensure the success of your program activities. Conduct a media campaign. The media are a large and influential sector of the industry, including television, radio, news, magazines, others mass circulations, print vehicles, and outdoor advertising for the HIV, AIDS, prevention, public knowledge. Outreach can include weekly magazines, newsletters, business reports, articles circulated by the organizations, newsletters from major employers, school, college, newspapers, and closed-circuit television. Communication is a valuable and prominent segment of the industry, including television, radio, news, magazines, others mass circulation, print. Prevention public can include weekly magazines, newsletters, company, journals, articles published by associations, newsletters from major employers, school, college, collegiate, newspapers, and closed-circuit television. Involved communications experts in the preparation of the media campaign. Like other people, they prepare to be active from the start and to know that their views are respected, not just the access they offered to media time and space. Develop a media contact list. Establish a relationship with the media. Concentrate on those media outlets your target population is most likely to see, hear, or read. Developing a relationship with the media is labor-intensive. Below are some ways to enhance your effectiveness in working with the media. Start with a media plan that includes a variety of strategies. Respond quickly and competently to media queries and deadlines. Plan media activities over time, rather than doing just one event at a time. This helps ensure your message continuously garners public support. Track media results, report successes and improvement plans. Recognize the contributions of the media by sending letters, notes, and emails. Be polite. Establish a rapport by talking with reporters on a first-name basis. Keep in touch if possible. Be informative and accurate. Always strive to be truthful. Do not be afraid to say, "I don't know," or "I will get back to say later" with the information. If you make a mistake, correct it as soon as possible. Do not blow up over minor typographical errors. However, significant errors should be called to the attention of editors or reporters in a courteous telephone call, meeting, or letter. Be consistent. If you use a statistic once, do not contradict it later. Use every opportunity to make a positive points and tell reporters about your organization's achievement. Keep to your message. Reporters are almost always on a tight deadline and allocate only a few moments to listen to information about your program. So your responses must be definite and positive. Use secondary points or qualifications for the remainder of your answer. Be responsive. Print and broadcast deadlines must be met. Not meeting media deadlines means not being included in a story and missing an opportunity to present the mission of your organization to more people. Recruit, train, support volunteers. Good volunteers are hard to find. You should provide support for your volunteers to promote loyalty, dependability, and dedication. You should provide them with training, supplies, instructions, and other support needed to do the job well. You should make yourself available to answer their questions and resolve problems. Recognize the contributions of volunteers. A personal thank you or handwritten notes goes a long way. Whenever possible, use a public gesture such as an award ceremony, a speech, or a press release to say, thanks for a job well done. There are specific duties, the amount of time they must commit to the effort, the location of the job, the project goals and objectives, the training requirements and commitments, the travel requirements. From your needs evaluation, you have already defined the types of services needed to achieve your objectives. To decide the number of volunteers needed, list your program tasks, and specify the number of people needed to carry out each mission. Establish a recruitment plan and create a written job description for volunteers. Implementing sound management practices. There are some basic management principles for success. These include strengthen systems and processes. View your organization as a collection of interdependent systems and processes. Appropriate staffing, equipment, and funding are necessary to provide quality services. Good supervision is important for the success of your program. Managers should understand how problems occur and how to handle them, thus strengthening the organization as a whole. Encourage staff participation and teamwork. Identifying and solving problems is not just a job for managers and supervisors. Every employee should be a part of the team and empowered to work toward recommending improvements and solving problems. Improve communication and coordination. All staff members, including volunteers, should work together to improve quality by sharing information freely and coordinating their activities. Demonstrate leadership commitment. When leaders are committed to good, quality employees accept it as a guiding principle for their work. Supervise staff and volunteers. You must always provide supervision to ensure the implementation of all services. A good supervisor listens to employee concerns, complaints, and suggestions, communicates to employees using clear, concise, and consistent messages, respects employees and never belittles, talks down to, berates or mistreats them, holds staff responsible for the work they do and the way they behave by providing adequate supervision to ensure the implementation of all directives. Emphasize accountability. Accountability is a very important element, and this includes financial accountability. You should have in place a mechanism to plan for troubleshooting and for resolving crises and disputes. We have a foster collaboration. There is a real value in establishing relationships with local and state service providers and communities. Effective initiatives have the daunting challenge of communicating, collaborating, and coordinating with the other community partners. This job requires a great deal of cultural awareness, expertise, appreciation, and time. Effective partnerships can add momentum to your program, which can often mean the difference between success and failure. Effective collaboration. Facilitate strategic planning. Help prevent duplication of cost and effort. Maximize scarce resources. Integrate diverse perspectives to foster appreciation and understanding of the community. Provide comprehensive services based on client needs. Increase clients' accessibility to health services. Provide a liaison for clients unwilling to seek services from government organizations. Many factors influence the success of collaborative efforts. The following factors are necessary for successful collaborations: mutual respect, trust, purpose, and understanding. Appropriate representation from all affected segments of population. Members' buy-in and ownership in the development and outcome of the process. Constant and ongoing communication among members. Tips for program contents. Provide educational awareness of the problems of HIV/AIDS as it relates to youth and young adults in the community. Provides activities for youth who were otherwise be engaging or experimenting in a protected sexual behaviors, provides referrals and support services for residents affected by the HIV/AIDS virus, offer trainings for professionals, paraprofessionals, or volunteers associated with identifying dysfunctional. Source: Public Management Institute, 358 Brannan Street, San Francisco, CE 94107. This brief defines program implementation, highlights the importance of high-quality implementation, identifies key factors that affect implementation, presents the step involved in achieving quality implementation, and specifies who has responsibility for quality implementation. The last section describes some practical lessons that have been learned about implementation through systematic research and practice. The focus here is on evidence-based programs. Although the implementation is relevant in all program operations and evaluations, whenever any program is being conducted, it is important to monitor the level of implementation that has been achieved so its impact can be interpreted appropriately. Identify the need, recruit workers, and deliver the service of product to the target population. However, implementing work-related projects involves, through prior preparation, the participation of various stakeholders and a mechanism that ensures transparency. If programs are poorly implemented, not only does it limit the opportunity for helping children and young people in need, but it wastes limited public resources because programs that are poorly implemented are unlikely to be very effective. Besides, it is doubtful that the programs will be very effective when the software is badly implemented. We don't know whether or not it works. Effective implementation is more than a contributing factor in setting initiatives up for success. Research shows that the quality of implementation plays a significant part in bringing about outcomes. Research on quality program implementation has identified a number of factors that can significantly improve implementation process to increase the effectiveness of programs. This issue brief discusses some of the fundamentals of quality program implementation that had been identified through research and practice and that may be useful for practitioners, policymakers, and researchers alike. In conclusion or recommendation, I therefore conclude that program implementation is so essential in every sector of the organization. Mass media campaigns can, if developed in a strategic way and informed by principles and theories of effective communication, be successful in conveying health messages to large sections of the population at a relatively low cost, and for this reason are a useful tool to promote health. The same applies to every evidence-based initiative in the field of human services. It is necessary to ensure that a high-quality evidence-based program is introduced in order to achieve the expected results. This means that we must track the implementation of the software on a regular basis so that we can make the necessary changes to help ensure a high-quality implementation.